Knowing about what happens during labour can help you feel calmer while you are going through it. Although every labour is unique, there are 3 distinct stages to it. Here we talk you through them, from the first twinge to delivering the placenta after your baby is born. The first stage of labour. The first stage of labour tends to be the longest. It's split into 2 stages, the latent stage and established or active labour. The latent phase of labour, you may not even know the latent stage of labour has begun. Your cervix, the opening to your womb, softens, thins and begins to open, or as we say, dilate, as it gets ready for your baby to be born. You will start having contractions, but they will not be regular at this point. Or you may find they are regular for a while, then slow down or stop. During a contraction, the muscles in your womb tighten, then relax. Some people compare them to intense period pains. You may also get back pain. You can take paracetamol if you think it may help. This is like the warm-up to the main event, so try to stay as calm and as comfy as you can. Having something to eat and drink will give you energy for when the contractions become more intense. If your labour starts during the day, it can help to stay upright and gently active by walking around, but try not to tire yourself out. If labour starts at night, try to get some sleep. You can also contact maternity triage at this point, or at any point. But if you're more than 37 weeks with an uncomplicated pregnancy, they are likely to advise you to stay at home until your labour is established. Some evidence suggests that if you do, you're likely to have fewer interventions. But being at home isn't best for everyone, so do talk to your midwife about what is best for you. It can be hard to say how long the latent phase will last. It can take hours or even days. It tends to be longer in your first pregnancy. There are things you can do to ease the pain. Stay relaxed, get ready for the stronger contractions. Find out more about early labour by watching our early labour video. You can contact maternity triage if you're having regular contractions, around 3 every 10 minutes. Your waters are broken, you have any bleeding, or your contractions are very strong and you're in too much pain to rest. Your healthcare team may be able to give you pain relief. You can contact us if you're worried about anything. Maternity triage will advise you if you need to go to the maternity unit or hospital, or if they need to come to see you at home for your home birth. Established labour. Established or active labour starts when your cervix opens or dilates to at least 4 centimetres and your contractions become stronger and more regular. Your midwife will check on you often once you're at the maternity unit or during a home birth. They will see how your labour is progressing and talk to you about how you are feeling. They will also ask if you need any pain relief. Your midwife will aim to check your baby's heartbeat every 50 minutes, check how often you are having contractions. They should check them every 30 minutes. Check your pulse every hour. Check your temperature and blood pressure every 4 hours. And they will also check how often you empty your bladder. And they may offer vaginal examinations to see how dilated you are, at least every 4 hours. If your labour is going well, you should not need extra monitoring, but your midwife will be there to support you and guide you. Your cervix needs to open to about 10 centimetres for your baby to be able to get through. This is called being fully dilated. If you are having your first baby, the established phase tends to be around 8 hours and rarely longer than 18 hours. If you've had a baby before, it may well be shorter, lasting from around 5 hours to around 12 hours. Transition. Towards the end of the first stage, you start to become fully dilated and your contractions will tend to get stronger and more intense. This is known as transition. It's different for everyone. You may get a strong urge to push, or it may feel like a lull and then a chance to rest. It may feel overwhelming, but your midwife and birth partner will support you to get through it. The second stage of labour. The second stage starts when your cervix is fully open. It ends once your baby is born. Inside your womb, the muscles will be tightening and loosening, and you will be focusing your energy on pushing your baby down and out. If you do not feel an urge to push straight away, this is called the passive second stage. Once you have the urge to push, you're in active second stage. Many people describe the urge to push as pressure in their bottom, a bit like feeling of really needing a poo. And it's likely you will feel 2 or 3 strong urges with each contraction. Usually you will have a break between contractions, so you can rest a little. Pushing can be hard work, but your midwife and birth partner can give you lots of support and lots of encouragement. During this stage, your midwife will monitor you and your baby closely, and help you to find a more comfortable position. If you would prefer to follow your instincts and push when it feels right, tell your midwife. If not, they could guide you through each push. There is no right way or wrong way, and the choice is always yours. An epidural can stop you from feeling contractions or getting that urge to push. If you have had one, it is normal to wait an hour or longer once you're fully dilated before you start pushing. When it's time to push, your midwife will encourage you if you do not get that urge yourself. Every labour is different, but once you start pushing, you're likely to give birth within 3 hours if it is your first baby, and within 2 hours if you've had a baby before. Once your baby's head is nearly ready to come out, your midwife may ask you to stop pushing and take some short breaths. This is so your baby can be born slowly, which gives your skin and muscle more time to stretch. Once your baby's head is out, the hardest work is over, and the rest of their body will normally slip out during the next contraction. After the birth comes the third stage of labour, the birth of the placenta, which we will explain in its own video.